Dr. Jason Lemieux from PhysioMed Oakville. With me is Tina Zebart, one of our kinesiologists. One of the most common injuries we see present to the clinic is elbow pain, either from golfer's elbow or tennis elbow. So if I'm having pain either on the inside or outside of my elbow, there's a whole host of things that could cause that. It could be anything from issues with your neck, issues with your shoulder, poor range of motion, inefficient energy transfer. We're going to go over a couple of the simple fixes you can use to start to at least give yourself some relief. Clearly, the best thing to do is get an assessment, because just because I have pain in my elbow does not mean my elbow is the source of my pain. So absolutely get the elbow looked at, because what you think might be the problem may not actually be the problem. But that being said, if we want to try to help our body recover from some of the things that happen to it in North American life, so constant texting, constant work on the computer, constant driving in the car, we want to try to break up any stiffness, adhesions, tightness into the muscles of the forearm. So outside of going and actually getting manual therapy on it, we've got a double lacrosse ball, so 2 lacrosse balls just taped together, and Tina's going to demonstrate how we can kind of self-massage or roll out the flexor muscles on one side of the forearm, going all the way from the elbow down to the wrist, and then the extensor muscles on the other side of the forearm. Anybody that has done this, or if you do try to do this, you're going to find all kinds of spots that are a little tender, a little sore. We're not looking to give ourselves, numbness or tingling. Your hand shouldn't go dead. But you will probably find some spots that are going to be especially tender or especially sore. So we want to kind of roll those areas out, no different than in other videos we've demonstrated foam rolling our upper back or our hips or our quads. We got to kind of work on those tissues of the arm as well. So I can have other postural adaptations that cause problems, or I can even have compression of the joint. So while we're going to deal with the soft tissues by using the roller, we can take a band, I can trap my elbow in the band, and I can walk out from the band to get some traction. From here, I can actually start working on the range of motion of flexing my elbow, passive flexion all the way in. And you may find a simple self-test is, as I stand with my arms straight, if I just tried to touch the front of my shoulders with my thumbs, I personally feel like it's a lot easier for me to do this on my right arm than my left. So if I were to traction my left elbow, work on that end range flexion just to gap the joint open, again, that should be 100% pain-free, then I'm going to find that that range of motion gets a lot easier. If we're one of those people that's chained to the desk, we can also use the band to create traction on my entire arm as I rotate away to get a really good stretch to the front of my chest, front of my shoulder. And the tighter you are, I might feel that stretch even hit my bicep or into the forearm itself, just to break up some of that postural stiffness. So we want to fix those postural concerns, get rid of all that crappy built up trigger points in our forearm muscles. But the other problem might be that you're just not very good at moving your body around in space, and you might be an inefficient you might be transferring energy inefficiently. So a very common exercise performed at home or in the gym is a dumbbell row. So Tina's going to demonstrate a good dumbbell row. So she's engaging the muscles of her upper back, moving her shoulder blade as she pulls. And what we're going to see is we're going to try to pay attention to the angle of her forearm in the ground. So as we'll just go 2 more good ones. So active upper back, we're going to look at the angle of her forearm. Very good. Now she's going to pull inefficiently. Now as she drives from her elbow, we're going to see that the angle of her forearm becomes more steep. Good. We got less pull from the upper back. She's now basically just flexing her bicep to pull that weight in. She'll still probably feel like her back's getting a workout, but by the end of this, that elbow is going to be really sore. Let's put that elbow down. In fact, we've had patients come in saying, yeah, I can't do any rowing or pulling exercises in the gym. We just make that simple correction to say, hey, stop pulling with your elbow. Let's start pulling with the bigger muscles of our upper back. The analogy I can make is if I flex my hip, my knee bent, but I didn't really think about bending my knee. So same thing as I pull, I can consciously bend my elbow, or I can pull with the large muscles of my shoulder, and my elbow bends as a result of that. So if I can make my elbow, just like my knee, kind of a secondary joint when I'm creating large pulling motions, that's gonna be a lot less stress on the elbow. You'll probably find you can perform your exercises with a lot less pain. So we want to roll out those soft tissues of the forearm, stretch out any postural tension that we have, and then start having better mechanics as we pull. Same thing with racket sports. So you almost never see a professional tennis player wearing an elbow brace, because they know how to rotate their body and create power from their legs and their body to let their arm finish the stroke, whereas a recreational player will almost always lead with their arm, forcing their elbow to absorb the max amount of force. So let's clean up our technique, clean up our body, and you'll see your elbow pain go.